to the next COVID patient. The U.S. topping 3 million COVID cases today and tonight. This is the grim reality across much of the South and the West, where COVID is exploding.
In coronavirus, 1 minute you're looking great, and the next minute you are gone.
This ICU unit started with 46 beds. They doubled those and now need more.
We are playing musical chairs in the middle of the night, moving one patient from one side to another.
Experts calling the Sun Belt the COVID capital of the world. In Arizona, cases more than doubling in just the past week. The mayor of Phoenix tells us that testing here is woefully inadequate, especially given the 33% positivity rate here in Arizona. That means that 1 of every 3 cars that drives to a testing site like this has a COVID patient inside. At today's White House Coronavirus Task Force, Dr. Deborah Birx asking those 4 states to roll back their reopenings even further.
Is really asking the American people in those counties and in those states to not only use the face coverings, not going to bars, not going to indoor dining, but really not gathering in homes either.
Nearly 10,000 new infections in Florida overnight, ICUs at 41 hospitals at capacity. Now a new hotspot in South Carolina. At this coastal hospital, dozens of staff infected. They've asked for the National Guard to help.
We're pretty well maxed out on ICU capacity. 96% that could happen quickly.
And the president tonight undercutting America's leading voice on the virus, Dr. Anthony Fauci, who advised Americans not to take comfort in a lower death rate.
I disagree with him. You know, Dr. Fauci said don't wear masks, and now he says wear them. And he said numerous things. Don't close off China. Don't ban China.
But tonight, the scope of the crisis encapsulated back in that Houston hospital.
It's horrifying because you can't get your breath. And all you can think in your head is, am I going to end up on a ventilator? Do I have to be on a ventilator?
COVID has been trafficking in fear and in death. For Dr. Varone, that agonizing call.
Excuse me, I'm very sorry.
Thinking about those teams and those patients fighting this, all describing similar symptoms as this moves across the country. Matt with us from a testing site in Phoenix. And Matt, you've been reporting here over the last couple of nights that people have been waiting in line for 7-8 hours in the searing heat, and then they have to wait for results. Some waiting several days, even weeks.
Up to 10 days, maybe more, David. That's if they can get tested. Now, epidemiologists tell us that means there is a lot of COVID in the community and not nearly enough testing. The mayor of Phoenix says she is asking the federal government for help, but the governor of the state, Doug Ducey, a state in crisis, hasn't been seen or hasn't spoken about the coronavirus in over a week. His team tells us that they're planning a briefing for tomorrow. David.
More than a week. All right, Matt, you'll stay on it. Thank you. Of course, the heated debate over whether to open schools across this country in the fall, some as early as August. Tonight, we take you inside the school board meeting. Students and teachers concerned, and the ER doctor, a father, who says even he doesn't know whether to send his child back. And the new decision tonight here in New York City. Here's Stephanie Ramos.
Tonight, with the virus raging and hospitals on the brink, the president putting pressure on schools, today threatening to cut off funding for districts that don't reopen in person.
We're very much going to put pressure on governors and everybody else to open the schools.
President Trump tweeting he disagrees with the CDC on their very tough and expensive guidelines for opening schools.
The president said today we just don't want the guidance to be too tough.
Those CDC guidelines call for safety measures like masks, 6 feet of spacing between desks, open windows, avoiding the cafeteria, and playground equipment if possible. But tonight, mixed messages from the White House Coronavirus Task Force.
I want to make it very clear that what is not the intent of CDC's guidelines is to be used as a rationale to keep schools closed.
The director of the CDC appearing to back off those guidelines. New guidelines now expected to roll out next week. But it comes amid those new warnings about the risk of indoor gatherings in states where cases are surging, like Florida, where there's heated debate after the state ordered schools to reopen in August.
I don't think it's responsible to go back to school.
At a Tampa school board meeting, students, teachers, and parents, like this ER doctor, are worried.
I think it'd be really hard to make a decision. So if I can't make that decision as a physician treating COVID patients who's comfortable in that space, I'm not sure how their parents can.
New Jersey teacher Adam Roth wants back in the classroom if it's safe.
We can have that much greater of an impact on our student population if we are with them, but just in a safe environment.
Today, the country's largest public school system, New York City, unveiling its plan to reopen with a mix of online learning with 2 to 3 days in the classroom, leaving it up to parents. The governor blasting the president, arguing he has no authority over the decision to reopen schools.
He then says, don't listen to the CDC. I disagree with them. Oh, really? Do you know, Mr. President, better than your health experts how to protect the health of students?
The president hasn't spelled out how he would cut off funding. He would need Congress to cut off the little he controls. Most schools are funded by the state and local levels, but the vice president has suggested the White House could tie the reopening of schools to coronavirus funding down the line. David.
All right, Stephanie Ramos live in New York. Steph, thank you. Tonight we are one-on-one with Attorney General William Barr.